I'm Maros Ferencik, and we are at the 8th annual scientific meeting of the Society of Cardiovascular CT. And here I have Dr. Suhny Abbara from Mass General Hospital, who is a co-chair of the annual scientific planning committee meeting. And Suhny, I would like to ask you about what's great coming.
First of all, I'd like to say I'm very pleased that this meeting was so successful. We have either near record or record attendance, and it's the first time that we went out of the United States with this meeting. We had some concerns that people might not want to travel and there may be some visa issues. So Montreal, it looks like, was a hit. We have a future couple meetings coming up, and I have this. The back of the annual program has the first midwinter meeting, which happens to be in Hawaii.
Oh, that sounds great.
Yes, and the early bird deadline fee is coming up. That's November 15th, a key date, and it's going to be a great meeting. And it's trying to bridge the Asian and the US population. So that's a great meeting to come. And just inside of that, on that cover, we have the next meeting coming up in 2014, the 9th annual meeting, which is in California, in San Diego. So we're working already hard on making that happen. A few nice things about this meeting is that it covered so many different things. We had a nurse and technology track with CE credit. We had great attendance, and so far gotten some good feedback. We're looking forward to getting more feedback in writing from that. And we have seen a few new technologies. CTA, TAVI, chest, abdomen, pelvis, using 20 cc's of contrast. So with the new technologies, fantastic new things are possible. We have multi-center trials on CT fractional flow reserve that all was presented here. So very pleased with that. A few things about education are coming up. The ACC criteria for level 1, 2, 3, they're being currently, and the COCATS criteria, they're being revised. Now that we know a little bit more about what's required for CT, we will be looking at revised criteria. At the same time, the SCCT will be soon bringing out what they think is needed for appropriate training. And it will relate to how much time you spend at a imaging facility and how many cases you get. Right now, you could do a weekend course or maybe a week's worth of course and be a level 2 reader. And we have learned more. There's some publications telling us how good you get doing that and how much time you maybe need at a facility. So that is something that will be coming out soon. And at the same time, as soon as that is out, the new ACC criteria, numbers will probably change. The certification board will at the same time change their numbers. I would assume that they will adapt what the ACC puts out for criteria. So if you haven't set for the boards and you don't want to be stuck with the new criteria, maybe it's a good time to go and sign up for CBCCT and get it out of the way while we have the old criteria in place.
So we have a sort of pitch here for the board exam and also for board preparation course, which was also a great success.
Oh, yes.
And so, I want to thank you for all this exciting news and all the new conferences that are coming and for your hard work preparing this, which the Society appreciates. So this is Maros Ferencik from the annual scientific meeting. If you are interested in more of our podcast, see us at YouTube/First in Imaging.